From the NewsChannel 5 network, this is OpenLine.
Hello, everyone. Welcome to OpenLine. Glad you are with us tonight. It is Wednesday, December 9th. And tonight we are talking about the rollout for the vaccine here in Tennessee. A lot of questions. Certainly this is good news. We have been waiting for this ever since this pandemic began back in March and April. So we will be talking all about how it will roll out, who will get it first, when you'll know if you're eligible. Happy to have with us the Commissioner for the Tennessee Department of Health, Dr. Lisa Piercey, joining us via Zoom, as all of our guests do now. Dr. Piercey, thank you for being with us. There you are via Zoom. Thank you.
Thanks for having me, Ben. I'm excited to talk to your listeners tonight.
Well, I appreciate you answering the questions and taking some calls. First question I have is, when will the first batch of vaccines be in Tennessee? And who will get the very first shot?
So great questions that we get multiple times per day. I want to start off by saying tomorrow is an incredibly exciting day. I'm not even sure I'm going to be able to sleep tonight because it's like tomorrow could be Christmas or a trip to Disney World, because we have waited for so long for a vaccine to be approved. And the FDA is meeting tomorrow to review and hopefully approve the first vaccine candidate, which is the one from Pfizer. And so the way the timeline will roll out is if that approval comes tomorrow, then we will start getting our first shipments within 24 hours. So they'll ship it out within 24 hours. It'll take a day or two to get here. I believe most of those are coming from either perhaps the Wisconsin area, somewhere in the upper Midwest. And so it'll take a day or two for those to get here. We have been tentatively told that the first large shipment of vaccine will be here on Tuesday, the 15th. So we're less than a week away. That date could change, and I do want to remind everybody, just at the top of the hour, any date or any number that I give is absolutely subject to change. Sometimes these change multiple times per day, but today we were notified that it's going to be December 15th.
So you expect it by Tuesday, and how many would be in that batch that you would get, theoretically, hopefully, by Tuesday? How many are we talking about?
We've been told to expect 56,000 doses on Tuesday. Now, the way that's going to work is that the very first allocation, which is the Pfizer allocation, will go directly to hospitals, because hospitals are where the very first people will get it. And if you think about it, it makes sense. If we can't maintain our hospital capacity, the whole healthcare structure collapses. And that's not just for COVID patients. That's for people with heart attacks or strokes or car wrecks. We have to have healthy hospital workers on the job. And that's not just doctors and nurses. That could be transport people or lab people or people in the cafeteria. Anybody who could come in contact with an infected patient in a hospital setting is absolutely top priority.
And how does that work? So we get this shipment of vaccines on Tuesday. Do they come to one location in Nashville, and then it's up to the state to distribute it to hospitals across the state, or how does that work?
Yeah, so some states are doing it that way, but we have chosen to send them directly to hospitals at the outset. That does a couple of things. One, it cuts out the middleman, if you will. So we don't want to have any extra delay by shipping it to us and then us parsing it out. The other thing it does is it helps to get, because Tennessee has such a wide geography, it helps us to get it to multiple places faster. And so it is going to be arriving at 28 sites, and those sites will be covering approximately 75 hospitals. So as you know, many hospitals have multiple smaller hospitals, and so they will either be parsing it out themselves, or they'll be bringing employees from some of the outer facilities into the main facility and give their vaccination there.
And did you say 56,000 doses will be in this first shipment? And how many healthcare workers? How many healthcare workers are there? So that takes care of what percentage of our healthcare workers?
So we have estimated that in phase 1A1, which is the very first group to have about 350,000 people in it. Now, that's not just healthcare workers. So let's talk about what all's in phase 1A1. Those are your high-risk hospital workers, like I just mentioned. Now, I will note it's not all hospital workers just yet, because it's just the ones who are most likely to come in contact with an infected patient or with infectious material, so like lab people or people who handle specimens. So that's one part of the category. Another part of phase 1A1 is first responders, police, fire, EMS, that have direct contact with members of the public who may be infected. Not necessarily the dispatchers or the administrative folks. They're coming soon, but the very first ones are those on-the-job first responders. And then a large portion of phase 1A1 is long-term care. So we know that a lot of our hospitalizations and deaths come from the long-term care community. And in that category are nursing homes and assisted living and other group homes for the elderly and aged. And so the staff and residents there are also in that group. So for 1A1 healthcare workers and first responders, it's about 200,000, and then another 150 or so in long-term care.
So that's 350,000 total. The first 56,000 doses you hope will be here on Tuesday. How long will it take to get all 350,000 of this first group that you just discussed? How long do you expect it to take for them to get their first shot?
I would ideally hope that we can have all of phase 1A1 done by the end of the year. But a lot of that is contingent upon what our resupply is. So basically when the second shipment comes. We've been told to expect 1 or 2 more shipments of unknown quantity right now after the initial allocation. So we do believe we're going to get resupplied pretty quickly. We just don't know that schedule yet. Now, we have 2 vaccines that we expect in the next couple of weeks. So the Pfizer one is the one that's supposed to be approved tomorrow. And then 1 week later, so next Thursday, the Moderna vaccine is scheduled to be approved. We've been told that we'll be getting 115,000 of that vaccine on or about December 22nd. So ideally, or it's been promised to us that we're going to have about 175,000 doses or so before Christmas. And it's our goal to get them in arms as quickly as possible.
How confident are you about the ability to get them in arms quickly? You've obviously been planning this for a while, but how confident are you that you can turn that around? And what is your turnaround time? You get it on a Tuesday. You hope to have those distributed within 24 hours, 48 hours. What is your turnaround time?
So a lot of that is going to depend on the local facility. So the hospitals that get them first, they already all have extensive plans. They have schedules of how often they're going to give them. You know, something that you have to keep in mind, we have recommended that they not vaccinate their entire workforce on the same day, because like with any immunization, you could have a headache or not feel well, and that's a good thing. I need to remind people that having a mild reaction after a shot means your immune system is doing what it is supposed to do. So that is not a bad thing at all. I'm not talking about serious reactions, but just not feeling good for a day or two. And so we've asked hospitals to spread out their workforce so they don't vaccinate everybody on the same day, but to otherwise do it as quickly as possible. Some of them plan to immunize their entire workforce in a span of 3 or 4 days.
3 or 4 days. And okay, so the first group, first responders, the elderly, this 350,000. How will other people know when they are eligible? How will regular people out, accountants, reporters, whatever, how will the rest of us know when it's time for us to go and get our vaccine?
Sure, that's a great question, and 2 or 3 things come to mind. First of all, we have a very robust communication schedule. So not only communicating through traditional media, but also social media, as well as several other communication formats. So there'll be a lot of proactive messaging pushed out to the public saying, if you fall in this category and whatever time for, then it's your turn and you need to go fill in the blank to a pharmacy, to your doctor, or whatever. The other way that everybody needs to make sure they're familiar with is looking at our plan. It's posted on our website. It's 46 pages long. You don't have to read all 46 pages, but right in the middle of that document is some slides that really detail out all the different kinds of industry classifications and jobs and health conditions and ages, and it will tell you what phase that you and in your personal circumstance are in. And so you can be watching for that. Lots of communication. And then something that we've got in the works, not live yet, but something we've got in the works is a place where folks can go online and sign up to get a reminder either through text or email or whatever when it's their turn. But lots and lots of communication. That's probably the most important thing in this whole response.
Another group that people are very concerned about, teachers, so that schools can reopen. Where are teachers in the line to get the vaccine?
Yeah, great question. So right now they are in our plan in phase 2. So there's 1A1, we've talked about that. Then there's 1A2, which is the rest of healthcare workers that's not in the hospital category that I mentioned. And then in phase 1B are older and high-risk individuals. However, the CDC is meeting multiple times this month. They've already met once. It's the division called ACIP, Advisory Council on Immunization Practices. You may have seen some headlines about a week ago where they made recommendations on long-term care. They're going to meet 2 more times this month and make recommendations of how essential workers, critical infrastructure, including teachers, where that falls out. But right now it's in phase 2.
Phase 2, when would you expect that to be based? And I know all dates are theoretical here, but let's say, it works well, and we get the first batch on Tuesday, and then this other vaccine is approved, we get 115,000 more. Things go along pretty well. When would you hope teachers would start getting vaccinated?
I would really like to have that by February, plus or minus February timeframe. Part of that answer is going to be contingent, as you just mentioned, on the resupply of the 2 vaccines that we expect to be approved this month. But there are also 2 more vaccines in development that could be approved in January. Those are the AstraZeneca and the Johnson & Johnson vaccines. Once those get approved and on the market, then we've got 3 or 4 vaccines to continually resupply, and we're going to be able to move through our phases more quickly.
And this takes 2 shots, right? It takes 2 shots 2 weeks apart. Is that right?
That's close. So these first, that's
well, then
close,
yes,
Ben.
please. I want you to say exactly what it is. It takes 2 shots. We got that right.
Well, you got 2 well, sort of. So the Pfizer and Moderna are both 2 shots. The Pfizer is 21 days apart. The Moderna is 28 days apart. The AstraZeneca, when it's approved, it will also be 2 shots. Not sure of that interval yet, but the Johnson & Johnson is 1 shot. And so that's particularly going to be important when we start going into widespread general public, because it requires a lot less of that special cold storage and handling that I'm sure you've heard about. It's more of just traditional vaccine storage. And with a 1-shot dose, you can really move through large numbers of people quickly. Don't have to worry about getting them back in for the same shot or for the second shot.
So we're seeing numbers really spike right now. There's great concern about the Thanksgiving surge that we've heard so much about. Thanksgiving about 2 weeks ago, so we're going to start seeing even potentially more on top of that. This vaccine, again, everything goes smoothly. When will this vaccine start bringing the numbers down?
That's a good question. I can talk pretty confidently about individual immunity. Herd immunity, which is kind of having immunity at a high enough percentage in the community that we really start to see the curve bend, is a little bit tougher. So on the individual basis, there appears to be pretty good immunity within a week after the second dose. You don't get full immunity until about a month after the second dose, but you really get pretty good protection, maybe 85 or 90%, a week after the second dose. So for that individual, that's going to be really important. Now, I try to take the opportunity anytime I can to remind folks, this is not a get out of jail free card. You can't just keep going around and like you don't get exempt from all of the restrictions. Your risk is less, and you are protected, but we still have to take precautions in our community because we don't have herd immunity yet. So when people start getting vaccinated in mass quantities, you will start to see that curve bend down. What I don't know is that we will see any of that before probably the end of January or early February, after people have gotten their second dose and starting to get it in big enough numbers where we can see a population difference.
So end of January or February. And so that's that's something to take note of, because when I hear that the first doses will be here Tuesday, I think everything's great. And that is great news. But you're saying we're seeing a big spike right now in numbers. We can't expect a big change until we're talking a couple of months. Is that right?
At minimum. I don't want to dampen anybody's enthusiasm for the vaccine, because I told you, I'm like a kid on Christmas Eve today, just so excited about it, because I know this is the beginning of the end of this pandemic, and that thrills me to no end. But it is not going to be immediate. It is going to take some amount of time to build up individual immunity, and then to build immunity in high enough numbers across the population to see a difference. It's going to be 60 days plus before we see any of that. 60
days plus is what we're talking about. So 2 months is essentially what we're talking about. And then let's say somebody is on the early end of getting the vaccine. They get both of their shots. Can they walk? They don't have to wear a mask. Are they kind of done with this whole pandemic thing, or what about that person?
Yeah, that's tricky, because while they're individually protected, we still have to take actions as a community and as a state to protect each other. And so while it may be tempting to let one's guard down, we really strongly recommend to continue having and using those good practices that we know about, because not only, and this is important, not only did those things protect against COVID, they protect against other things. That mask protects against the flu, and may be a very, very effective tool in reducing flu spread or strep or any of the other things, colds that go around in the wintertime. And so anything we can do as a community to reduce the burden on our healthcare system, whether it's COVID or anything else, is what we need to be doing right now.
So when I say, when will life be back to normal, what do you say?
Well, I was at the White House yesterday with Governor Lee, and we were at a vaccine roundtable, and that question was posed to Secretary Azar and other leaders in the White House. Their estimate was summertime, and that feels like a long way off. But I don't want to decrease anybody's enthusiasm for what we've got going starting next week. But it will probably be late spring or early summer before we start to see some normalcy.
Okay. All right. Well, that kind of sets the table for our discussion. And now I want to start taking calls, because there are plenty of other questions out there. We'll take a break. And there are a few lines open. We have a lot of people on the line, but there are a few lines open. There's the number, 615-737-PLUS, 615-737-7587. We'll take a break. Be back right after this.